Good afternoon and welcome to the Flint Community Webinar, your community resource every Friday at noon. We are so glad that you are here. You are in for a big treat. We have a takeover happening on the webinar this week. What does that mean? It means we turn over the entire hour of the webinar to, you're getting a taste of who it is right now, the Genesee Health Plan. So look at this. I don't know that we've ever had any more speakers and panelists and folks show up. So we are grateful to be able to highlight the work of the Genesee Health Plan this week. I forgot to introduce myself. I feel like you already know me. I'm Heather Lynn Uphold. I'm faculty at Michigan State University here in Flint. So glad to be here with you. GHP, so the Genesee Health Plan, they're going to be talking about Medicaid unwinding, healthcare updates and what to expect, and as well as a community essay contest that's coming up. I know you might have heard some of this Medicaid news and things that are going on, and we wanted to bring the source of credible information, credible messages, and expertise from our partners over at GHP. I'm going to turn things over to Jill Milanowski, who's the president and CEO at the Genesee Health Plan, and he'll take it away. Thanks, Jim.
Well, hi, Heather. How are you?
Good, thanks.
Good. You know, when you and I first talked, we talked about maybe mixing it up a little bit for this takeover, maybe doing it in reverse, starting with the last frame and then going to the front. So we kind of ruled that out. My next thought was for me to speak for 55 minutes. And I thought, no, that probably wouldn't be good either. So what we decided to do with our takeover is to bring together our GHP staff and have them share the story of what we do, the services that we provide, and the work that our staff does. And so I'm not going to speak much until I might, but we're going to bring everybody up to the podium, and we are going to start with Katrina Whisker. She is our director of operations, and she's just going to kind of kick things off for us. Katrina.
Hello, everybody. Thanks, Jim. I am so excited for our team to be able to share the great things that they're doing throughout Genesee County. We have some wonderful programs from not just our Genesee Health Plan, but the cultural system of care that we're excited for them to be able to share everything with you. I just wanted to give you a brief overview of Genesee Health Plan. Obviously, we're a countywide health plan, so we have services that go from Otisville all the way out to Linden. And then, of course, we have our concentration of services that we offer in the city of Flint, from helping over 10,000 individuals register for the Flint Registry to our community health workers in the Flint community schools. And we're just excited to be able to share that full spectrum of our services with you. Another thing that we wanted to look at was talking about our social determinants of health, kind of like our foundation of our work. So it's not just the fact that we offer our healthcare coverage and we're helping to direct people to the right coverage, but it's also looking at what are those other factors that help bring people to needing care related to their health conditions. You know, for those individuals that may not have access to healthy foods, they could be more at risk for obesity and for diabetes. And we want to be able to be in a position to help deter some of those conditions and help people get the right supports that they need. We're very grateful that we have Shauna Leonard from DHHS. She is in our office and she helps our staff on a daily basis, help navigate those systems, helping people get registered for food stamps and help them work through any barriers that help come up for access. When we look at our programs, you might hear our staff talk about what are the income qualifying factors for programs. Just like so many other state and federally funded programs that are out there, there's always qualifying factors for those. And with our programs, that's no different. So you might hear people talk about what is 100% of poverty. You know, for a family of four, that might look like an income of around $30,000. For those programs that are up to 250% of poverty, such as the Genesee Health Plan, a family of four could earn about $69,000. And those are adjusted every year so that we know who are the families that are most in need of qualifying for our programs. We have a phenomenal staff on board here, and our next person will be talking about more about our enrollment services, but we want to make sure that we're helping all individuals go through and find out what programs they qualify for. It is a lot to help determine what an income qualifying factor is, what that percentage of poverty is. Let our staff help you, and those at your programs out in the community, let us help you determine what programs you qualify for. So thank you so much.
We're next going to hear from Jill Alexander, who's our enrollment coordinator, and she's going to talk about all those different types of healthcare coverages that we can help people enroll in. Jill?
Good afternoon. I'm Jill Alexander, and I have the pleasure of talking about our enrollment staff and the services that we do offer. We don't only just do GHP enrollment. We are certified to assist with Medicaid, Marketplace, and Medicare coverage. Even if you have employer coverage and you're just not understanding what's covered, what your out-of-pocket costs could be, you could always give our team a call as well, and we can kind of simplify what your out-of-pocket could potentially be as well. Prescriptions, formularies, what's covered, what's not covered. Maybe the copay is too high. We have a great prescription assistance guru who can help you maybe discount that or have no copay at all, working with the pharmaceutical companies and other vendors that can assist with copays and deductibles and things along those lines. Outside of healthcare coverage, Genesee Health Plan does contract with Delta Dental. So we do have enrollment services for seniors and veterans who reside in Genesee County as well. So definitely give us a call with any healthcare questions, dental needs, and we look forward to hearing from everyone.
So Jill, Heather, when she introduced us, talked about this Medicaid unwinding. And so when I think of unwinding, I think of going out at happy hour with the staff. But what is she talking about, this Medicaid unwinding?
So the COVID-19 public health emergency has eliminated the redetermination paperwork that you receive from MDHHS.
So every year people have had to re-enroll once a year into Medicaid, correct?
Correct.
Yeah, and
Yes.
so now that is going away. And people are going to have to go back to, they have to go back to that. That was frozen because of the pandemic.
Absolutely.
Yeah.
Nobody's coverage was termed for almost 3 years.
Right. And so there's been a lot more people that got on Medicaid. And so it's not a time to freak out about this, because this has been a usual case prior to the pandemic. But really the best thing that people can do right now is make sure that their address is current with the state, correct?
Correct. Yes.
So what's the best ways of doing that?
The My Bridges portal. You could always give us a call and we can log in and assist you with that as well.
Okay.
As well as our Miss Leonard, our caseworker here.
So yeah, just contact us. We'll have that contact information later for everyone to see. But yeah, just make sure that if you're on Medicaid, they're going to come and reach out to you at some point over the next 13, 14 months to re-enroll again, to make sure you prove that you're eligible. And so just make sure that the state has your most correct address so that you're not waiting for this packet that never gets to you, and that the state doesn't think that you're not interested anymore in having that healthcare coverage. So,
Correct.
all right. Well, thank you, Jill.
Yeah. Real quick, Jim and Jill, what's that process for like, what kind of information are they going to ask for? Is it going to be a complicated process?
It's the same process that took place pre-COVID. So you do receive a packet and it lists all household members when you originally applied, income that you used or had when you originally applied. And it's kind of confirming that, yes, we still have all of the listed household members, and then they'll ask for proofs of income. So last 30 days is usually what they're seeking.
Okay.
So they can do a paper packet or they can go online
Yes.
and do it that way as well. So,
Awesome. Thanks, you guys.
all right.
Thank you.
So we talked about enrollment, and you can see Jill here as she's been we hit the circuit and do a lot of media on letting people know the answers to a lot of these questions. And then once a year, we get together with our partners and we do a phone bank of enrollment. So that usually occurs either in November or December. And what's neat is that all our partners, we've done a tremendous job in Genesee County on getting people enrolled. and so into healthcare. And so our partners like from Hamilton and Greater Flint Health Coalition and VAAA come together, and the phones ring off the hook. It's really there's always so many questions. So that's what we really are here for, to be that place to call or contact to get that information. So we do a lot of this type of where we do webinars or we do appearances in the media, but we also do a lot of boots on the ground. And so one of the groups of our staff that really are out there in the community are our community health workers. And I'm going to bring up Sharika Finkley, who's our CHW coordinator. And Sharika is going to tell you all about our community health workers. Come on, Sharika.
Good afternoon, everyone. I'm Sharika Finkley, the Community Health Worker Coordinator here at Genesee Health Plan. We began to have community health workers, the Community Health Worker Program here at Genesee Health Plan back in 2015 through a partnership with the Crim Fitness Foundation called the Community Education Initiative. This initiative is funded through the CS-MOP Foundation. And the purpose of this initiative is to provide critical supports and programs in Flint area schools. So that looks like after school programming, sports, and all other types of clubs and things like that, which are handled in the school, including health services. And so that's where the community health workers come into play. So the goal of the community health worker program is to bridge that gap between healthcare and other services in the community. And so our community health workers work really hard to make sure that we are connecting with every family within our school buildings. We are currently housed in 13 schools right now. So all of the Flint area school, Flint community schools, as well as International Academy and the Flint Cultural Center Academy. And so what our community health workers do is what makes us unique is that we reach out to every family in our buildings to complete a comprehensive health assessment with those parents. And what we're able to gauge from those assessments are what their needs are. So we look at the social determinants of health, as Katrina had mentioned earlier, and based on what we find during those assessments, we're able to get our families linked to health resources and other resources in the community, such as food, housing, clothing, things like that. As a result of the things that we have identified as needs in our school, our community health workers have worked really hard to bring in programs and services to provide to families, such as our Riding Above Barriers program. We received a grant from the Sunrise Rotary Club to provide bus passes for some of our families who were in need of transportation. Additionally, we have a program that's called Loads of Love. That program was created because so many children were coming to school with unclean clothing. They were being bullied. It was just causing a lot of problems. And so one of our community health workers looked out and reached out into the community and was able to seek donation dollars. And so as a result of that, we're able to provide families with passes to go to ProClean to clean their clothing and still be prideful about it. So those are just some of the great successes that have come about of this program. In addition to those services, we also work very closely with school staff. We are a part of several teams, including the attendance teams. There's huge issues in our schools around attendance, kids not getting to school. And so one of the roles that the community health workers play is mentors. There's a program called the Success Mentoring Program, and our community health workers have tasked on taking in between 3 and 10 kids to mentor them, to work with them on learning the importance of being in school, being on time for school, in hopes that on the back end, we can start on the back end and help encourage our parents as well to get our kiddos to school. So those are just some of the programs that have been provided. But in addition to that, our community health workers don't just stop at health. We want to make sure that they're getting linked to utility services if they need. We can help them with completing the state emergency relief program package through the Michigan Department of Health and Human Services. We make sure we get them linked to other community organizations that may help with utility assistance or housing. So those are just some of the unique things that our workers, our community health workers do to make sure that our kids and families have what they need in order to live a healthy and successful life. And I think that we have a video to show.
Yeah, we have a video that really shows what a community health worker does at one of their schools.
Hello, my name is Richard Earl McQueary. I'm a community health worker here at Dora Ryder Elementary, along with the Genesee Health Plan and the Crim Foundation. Are you asking me a question, or are you telling me, Mr. McQueary, it is a country?
I'm telling you.
Then what should you do?
Put it down.
There you go. Kids. I love kids. I know my job here, first and foremost, is families. Dealing with the parents, trying to get them a health assessment, trying to get them some type of resources, trying to get them insurance. But this SPM, this Success Mentorship Program that we're doing right now through the CRIM and helping students is something that I love. I love working with kids. I love interacting with kids.
What's your favorite thing about hanging out with Mr. Ricky?
He take us to the gym every Friday, and he help us remember he help us remember stuff.
Thanks, buddy. Do good. Hey, just remember, do good, be good. You hear me? All right.
I love the work that we do, Sharika. And so we have a couple pictures here. Obviously, you and I have done a media on one of the TV stations, but the middle picture was really something that I was very proud of. There are children in our community that don't have a bed to sleep in at night, and it's just shameful that occurs. And so, talk a little bit about how our community health worker got involved in a project.
So our community health worker at ALA, or Accelerated Learning Academy, was working with a family who were in need of beds. And so she began to diligently look in the community to find bedding for this family. And she came across this organization called Sleep in Heavenly Peace. And so this organization, they actually build beds for families that are in need. And so our community health worker took it a step further and was able to help organize what became a huge event where they were able to build 30 beds for the community, for families in need. And so our community health workers, students at ALA, and other volunteers from Sleep in Heavenly Peace and the community all came together over at ALA. And they went boots on the ground, and they actually built these beds by hand. And so in this picture, you can see our community health worker, Virginia Riggs, who's the community health worker that spearheaded this all. And that you can see the wood behind them and everything. They really built these beds by hand. And when they delivered the beds to the homes, they actually went in their homes and put the beds together. And the kids were actually able to help put their bedding together once they got them to the home. So this was just a wonderful event. And it's just a clear description of how our community health workers go the extra mile to make sure that our families are overcome these barriers that they may face.
Absolutely. And so the last picture on the right is the team, including Virginia, but the rest of the community health workers. And about 2 years ago, right in the middle of COVID, our staff got a special award, a community health worker award through Spectrum Health out of the west side of the state. It was called the Mosley Award. Talk a little bit about that.
Yeah. So each year, the Michigan Community Health Worker Association, better known as MiCHWA, they have a conference every year with Spectrum Health. And each year, there's a community health worker team that teams are nominated each year. And this particular year, our team was nominated. And this is because of the spectacular work that they have done in the community, specifically around COVID and the water crisis, because our team diligently worked through the COVID, and we continue to assist families through all of that and through the water emergency. So our team was nominated and selected that year for the Team Mosley Award. So we are very proud of that.
That is a special honor. So thank you, Sharika. Thank you for giving us some information. And that we have a team in all the Flint schools and some of the charter schools, and they're also part of that community surrounding the school as well. So,
Absolutely.
all right. Well, thank you, Sharika.
Thank you.
All right, we're going to hear Sharika mentioned about helping with utility assistance, and that is a huge need in our community when, especially with rising utility prices and we just get so many calls on that, and so we're proud to be in a partnership, and Sandy's going to talk about it. I'm introducing Sandra McKay. She is our GHP Community Navigator for our Empower Genesee program. Sandy, tell us about this program.
Jim, I am Sandra McKay, the Community Navigator for the Empower Genesee program. It was launched in 2019 in partnerships with Consumers Energy, Ascension Genesis, Huntington Bank, and of course, Genesee Health Plan. The idea behind the program was to help residents and families connect with utility assistance and other resources. What we want to do is conquer the issues surrounding social determinants of health, such as food insecurities, housing, personal items, transportation, employment services, what have you. So what we wanted to do was to centrally locate myself, the Community Navigator, and the Empower Genesee program in convenient places for the community to reach and access all of these resources. 2 days a week, I am located at the Consumers Energy Payment Center. 2 days a week, I am at the Ascension Downtown Clinic. 1 day a week, I'm at my home at Genesee Health Plan. And once per month, I am at the Clio Safety Net store in Clio. While I'm at those organizations, I'm able to reach out to parts of the community that are not only aware that there is help available, depending on what their needs are, but also educate them on a lot of different things, such as healthy living, and the fact that there is other resources out there and the different possibilities that is available for healthcare and or prescription assistance. A lot of the community doesn't understand that just because there isn't a child in the home, you could still qualify for different assistance programs through the Department of Health and Human Services or other agencies. In order to contact me, you could scan the QR code, which should be presented on the screen. You can also contact Consumers Energy, Ascension Genesis, Huntington Bank, or Genesee Health Plan, and they will refer you back to me and I will get a hold of you as soon as possible. What I do is, it's great. It's definitely a labor of love. But once a week through our organization, we share success stories with each other. And one of my favorite ones was helping a grandmother who was raising her grandchildren. Unfortunately, that does happen in our community, but luckily there's family that can step up and raise their family members' children. But being a grandmother, she is no longer of working age and she is only receiving disability, which if we're all on the same page, it's hard to budget, especially when there's unforeseen circumstances. She had to replace her fuel oil and transfer it back over to natural gas. She had no idea how to do that. So she called the Empower Genesee program and I helped her every step of the way. We were able to get consumers on board as well as NDHHS. We were able to complete the applications and not only have consumers over to replace her fuel lines back over to natural gas, but also had a heating and cooling agency in there installing a brand new furnace for her and her family to enjoy a warm winter. I still keep in contact with her on the weekly and she is very thankful. That's just one of the many success stories that we have at the Empower Genesee program.
Thank you, Sandy. Just stay there for a moment because I want to talk about how this kind of got together. So this really is a unique public-private partnership between us, Consumers Energy, the utility assistance, the Huntington Bank, and Huntington Bank, just about 3 weeks ago, they were holding financial literacy classes in this room, correct, Sandy?
Absolutely. We had a series of 3 financial literacy programs. They were fantastic. We brought people out from the community, brought them in, and we did our best to just kind of make them feel comfortable on learning how to deal with their own money, how to budget when you are limited on your income. If you wanted to buy a home, these are the steps that you have to go through. If you already own your home, here's what you can do to make your money more lucrative. It was incredible. And we do look forward to having more of those classes.
Yeah, I think we will. It was very successful. And Ascension Genesis is a partner. I know you go to one of the clinics right downtown and meet with their patients. And then I want to talk just a moment about this payment center. There's one on Court where when we first got this project together, they were saying that like 10,000 people came there a month. And I'm like, nah, that can't be to pay their utility. But as you found out, that was true by being there. And I think there's a little bit less now because of COVID and people are kind of used to now making other arrangements for their payments. But it really is right there, being in that spot where there are thousands of people coming. And they might be coming in there to pay their utility bill, but they need all kinds of other things that you had mentioned, correct?
Absolutely. The idea when they launched the program was Consumers Energy was looking for someone to help them because so many people were coming in saying, I can't pay my bill and buy my prescriptions. I can't pay my bill and feed my kids.
Right.
So consumers got a hold of Ascension, who then got a hold of Huntington, who then got a hold of us. And then we all got together and had this program. And again, centrally located at the Consumers Energy Payment Center so that they have better access to these resources to help them out.
Well, wonderful. Well, thank you, Sandy. I think that's one that we need to get the word out more. Not that you need any more work, but it just utility assistance is just huge. And so anything that we can do to help with that is I think a very positive. So thank you, Sandy.
Thank you.
All right, we're going to hear next from Perlita Irish, and Perlita is our bilingual health navigator. During the water crisis, as we were assisting people in our community, we discovered that there were a lot of folks in our community that needed assistance, had a lot of questions, needed some help, and not always spoke our language, or maybe their culture interfered with them accessing services. So United Way was very kind to the health plan and gave us a grant, and that gave us Perlita. So Perlita, I'm going to turn it over to you, and you can talk about how you assist this group of folks.
Well, muchas gracias, Jim.
Whatever she said.
Good afternoon, everyone. Yes, my name is Perlita Irish. I'm the bilingual health navigator here at Genesee Health Plan. And I'm here to talk about our wonderful program that started back in 2016. And this program focuses to assist individuals with cultural and language barriers during accessing healthcare. So some of the services that we provide are medical interpreting. I am a trained interpreter. Also, we provide transportation for those that don't have coverage and they need to go to the doctors, or they need to go to get groceries or to the pharmacy. We know a lot of times that transportation is a big issue in our community, and we partner with MTA. A couple years ago, they did a program that is called. It was to we can do exact take the person, for example, if you don't know how to ride the bus, or you don't know where the bus stop is. We can do this tour for you. I can help you with that. That will make you feel comfortable about utilizing the transportation services. Another service that we have, if you need to set up an appointment with your doctor and you don't speak the language, my primary language is Spanish, and I can set that appointment out for you, navigate through that system, meet you there, assist you with the paperwork, assist you communicating with the physician, because a lot of times the physician, they're not going to be able to treat you if they don't know your culture. That's very important that they understand that, and they understand the barriers that you have. Also, we don't stop there. We have a lot of resources that we assist with, like our CEO was talking about. we have a DHS worker here. And currently the state only has 2 Spanish-speaking workers. And so our Latino community is increasing day by day, so the workload is a lot. So for me, I'm just a liaison between the DHS worker and our clients. So I can help you with paperwork if you need. I can do the applications for food, cash, and also for health coverage. That's another great resources that we have here. And if you have testing that you need to do that your doctor orders, I can assist you with that. I can meet you at the imaging location or wherever you go. You go to McLaren, you go to Hurley, you go to Ascension Genesis, I'm there. I can assist with whatever you need. And if it's something that I cannot do, I can connect you with the resources or the people that will help you, guide you through this process. So just having your personal, a Spanish-speaking health navigator, that's me. If you need my services, please don't hesitate to reach out. I know how hard sometimes it can be to make that phone call, but I'm here to help.
Perlita, I want to talk about this because this is something that I was guilty of this years ago, where if someone had a language barrier or even the deaf and hard of hearing, a provider's office might say, well, just bring a family member so that they can interpret. But I know I wouldn't want my family to know all my healthcare business, and I'd feel very uncomfortable. And so this provides a different alternative, doesn't it?
So it's sad to say that some facilities will utilize their family members, and really they shouldn't be doing that because that it is a huge liability. They are not trained medical interpreters, and sometimes they can deliver their own message and their own interpretation and follow wrong directions. For example, like medications, it's very dangerous. They're not supposed to do that. They're supposed to provide an interpreter for you. And you don't really want your child going for a female going with you to have a pap smear. That should not be happening. So again, these are the great services that we provide. If you need a medical interpreter, please let us know. I will be very happy to help you.
Very good. We have a short video to show kind of Perlita in action. So let's show that.
Mira, me siento más protegida.
Antonia is visiting a podiatrist today. Accompanying her is a translator from Genesee Health Plan.
I love helping people. I've been involved in our community for many, many years, and to be able to help them in a way that it might be easy for other people, but simple things can change their lives. It's not just translating, but explaining to them in a way that they can understand what's going on and what do they need to do.
Tell me, how helpful is it to have a translator during times like this?
Yeah, it's helpful because the patients, if I can give instructions, it's easier to understand the instructions and it's easier to follow through.
Entonces, es mucha ayuda porque ella te puede explicar bien lo que el doctor dice. Entonces, es mucha ayuda lo que ella nos ha dado a nosotros.
¿Quieres que digo que te hiciera otra cita, verdad? En una semana.
¿En una semana?
Thank you, Perlita. You provide a great service, and that person's there in that one picture on the left again. And what was that group that you're involved with on the right there?
So the group on the right, it is we had some classes. We partner up with MSU Extension, so we have some. These are classes that teaches you the right kinds of foods to eat. For example, like we'll use Antonia as an example. She's diabetic. She was overweight. Her glucose was not controlled. And assisting these classes, it provided a major change in the lifestyle that she was used to, and she was able to decrease her hemoglobin A1C when she first came. It was very high. And then she was able to use those tools to make a lifestyle change. And my coworker here coming after me, she's gonna explain to you guys more in detail about what happened. But these are the cooking matters that these classes, we provided them in Spanish. I was the interpreter for those classes. And it is a very helpful education for everyone.
All right. Well, thank you, Perlita. I appreciate that. And again, I think I just saw some information go into the chat on how to access Perlita. And let's not forget about that deaf and hard of hearing population either. CAC, Communications Access Center, provides interpretation, medical interpretation. So anybody in that community can also contact them to get assistance. So next we're going to hear from Melissa Schaefer, and she is our women's program health coach and works with primarily our Wise Women program. And we're a little excited to share about this program as well, because there is some overlap, wasn't there, on working with Perlita's population. So I'm going to turn it over to you, Melissa.
Okay. So the Wise Women program is a program designed to help women lower their risk of heart disease and stroke. And we achieve that through healthy lifestyle behavior changes. So with the program, we bring in women and conduct cardiovascular risk disease screenings. And we have all of the machines in-house to run those measurements. And then we have a one-on-one discussion with the clients, letting them know what those measurements mean and ways of correcting them. In order to achieve that, we have barrier reduction tools that we utilize with the women. And the Cooking Matters class is another really great resource that we use for that. That client that was previously pictured, she had she brought her A1C down by over 7% when she was in the program, and also lost over 30 pounds while she was in that program. Pictured here is the Cooking Matters courses that we work with MSU Extension on. So we teach them how to cook healthier and modify recipes, so that way they can achieve their healthcare goals.
Melissa was, the one picture on the left is U.S. Representative Dan Kildee. Was he a good cook?
He tried.
Okay.
He tried.
Oh, wow. I hope his office has been watching on this one. So, but yes, this is, even during the pandemic, we had to kind of, because we were doing these classes, right? But we couldn't have people gathered here. So we had it, and that's what that one picture on top there is, that we had to gather all the supplies and do a virtual class. So talk a little bit about that.
Yeah, so we had shifted from in-person classes to doing virtual classes. And one of the big staples with the Cooking Matters courses is that typically the clients are provided with the groceries to take home and recreate the recipe that we went over in that class with. So once we had to shift to doing online, we would purchase the groceries, bundle them up, as you can see in the pictures, and then we did home deliveries the night before the classes were to occur, so that way they could cook along with us while we were doing the class online.
Yeah, and so again, the work never is done, whether it's a pandemic or whatever. And so, like, give an example. So, of substituting like an item for an item that maybe is not healthy versus healthy.
So a simple switch with a lot of things that most people can handle and it really actually enjoy is swapping out either ground turkey or ground chicken for ground beef. It's lower in fat. And then if you're doing more of the cooking, you can control the amount of sodium that you're putting in there versus using processed boxed meals where you're just preparing it with the seasonings that are already in there. So you can control your sodium a lot better if you have high blood pressure. Another great swap is, especially with our Hispanic group, encouraging them to swap from flour tortillas to corn tortillas, because the carbohydrate count in the difference between the two is about half per tortilla. So especially the diabetic clients, they were able to cut back a lot of the carbs that they were ingesting in their diet by just making that simple swap.
So yeah, so love the cooking classes, and then your one-on-one coaching with women who really haven't had a lot of resources before, and they're able to get this, really a baseline of where they're at, with their blood sugar, with their blood pressure, all of that, and then you follow them, correct, and make sure they have resources too.
Correct. So once they come in and we do those measurements and kind of talk about where they're at with everything, I will have the conversation with the woman and have her set a goal for herself, something that she feels like she can achieve. And then I'll bring her back in about 3 months and redo her measurements to see where she's at. But in those 3 months, we are doing one-on-one health coaching contacts. So the program doesn't look the exact same for any two people, because everybody's a little bit different with their healthcare goals, and then also the barriers that they have and deal with on a daily basis to achieve those goals. So we try to customize it as much as possible per person. And then after that 3-month mark, we recheck all of her measurements. And then at that point, we can kind of navigate to focus on another area. So that way she's not being overwhelmed with working on too many things at once.
Great. Well, thank you, Melissa. And I just want the audience to know that I am the official taste tester quality control agent. And so everything is of high quality that Melissa and the group produces. So thank you, Melissa.
Okay.
All right, we've been hearing the word navigation a lot. So I want to bring up our Help Navigator coordinator, Jennifer Braden, because we've been doing that all along with our members, is really helping them navigate healthcare. Healthcare can sometimes be very confusing, and so Jennifer is our coordinator of the staff that really help our members as well as anybody in the community, really linking them to a lot of resources. So Jennifer, tell us about our program.
Yes. Thank you. Good afternoon. So the Health Navigation team, we are composed of 3 registered nurses. We have a total of over 97 years of nursing experience and knowledge within our team. We are here to help our clients to manage their chronic health conditions. We also help to assist our clients to prevent chronic conditions from occurring. We also like to help with finding medical items that may not be covered, such as medications, diabetic testing supplies, durable medical equipment, and more that, like I said, may not be covered by the insurance, health coverage. So we reach out and we have a lot of community resources that we can link you up with. And we are always available to you. And we love hearing from clients and talking and health coaching and educating and empowering our clients to make those healthy lifestyles and help assist them to continue the healthy lifestyles. So please feel free to reach out to us. We love hearing from you guys. We are here for you.
So Jennifer, just real quick. So I know Jill talked about it, and I know you are involved in this as well in your team about prescription assistance. So there are many medications that you and I are prescribed or people in the community are prescribed that aren't covered by insurance, whether it's the Medicaid, because a lot of times there's what we call a formulary, and that sometimes doctors prescribe medications that aren't covered. And so when they go to the pharmacy and they're expected to pay out of pocket, wow, there's a sticker shock there. So what is this prescription assistance and how can people get help with that?
Okay, so basically what the prescription assistance program is, we find applications for clients to get these medications delivered to their homes for free at no cost. What we do is we search websites to find these applications. We will print them off. We will highlight what needs to be filled out for the client. And we will mail it out, or if they come into the office, we will provide it here. We follow up with them regularly until they have been approved and have received the medication. And we know that they're taking it as the doctor has prescribed it.
Great, because that, there are these programs out there that most people don't know about. And so, and GoodRx and some of those other ones that the pharmacy works on. The health plan, we kind of totaled it up last year that through our prescription assistance program, we got free medications to people that were valued at close to $200,000 that otherwise, again, people might have been stuck trying to pay that, or trust me, most of the time, if people have to pay, they're not going to take it. They're not going to, especially at those high numbers. So thank you, Jennifer. And I appreciate the work of our health navigators. And you can see on the right-hand side, that's one of our health navigators out in the community at a health fair doing blood pressure screenings and other things. And so we do a lot of work out in the community. And so I'm going to turn things over to Jamika Thomas. And Jamika does a lot of things for us. She's our project coordinator, but she's going to tell us about two different things that she's helping to coordinate for us. And really, that external outreach is so important because not everybody is going to come into our office. We have to be out in the community. And I know the webinar is really focused on folks like Nurse T and others that are out in the community. So Jamika, tell us about these two programs.
Thank you, Jim. Good afternoon. I am Jamika Thomas, project coordinator for the Ensuring Successful Return program here at Genesee Health Plan. No one in Genesee County should be without healthcare coverage. Genesee Health Plan is here to help, and we have done so for 20 plus years, which says to me that we are a trusted source for your healthcare needs. The Ensuring Successful Return Project was an initiative that was created in 2015 as a pilot to address the needs of returning citizens and to help break down some of the barriers that they faced when they returned home. Our goal was to ensure families impacted by incarceration were aware of their healthcare needs, healthcare options, enrolled in healthcare coverage, and were appropriately linked to other community resources. In the early phase of this project, some grant dollars were offered to some community partners. Here at Genesee Health Plan, we don't believe in reinventing the wheel. We believe in collaborating and working with community partners to do the work that we do. We don't do it by ourselves. We work great with our community partners. And two of those partners for this project were Motherly Intercession and Made Institute. Our work engages leading experts from all across Genesee County. And in expanding this initiative, it warranted us to establish other relationships, like with the Michigan Department of Corrections and Probation and Parole, the Genesee County Jail, Reconnections and Catholic Charities. Those are just a few of the partners that we work with to help the citizens that are returning and their families to make sure that they are getting connected to services. We work closely with Motherly Intercession in the Genesee County Jail to just meet people where they are. And so when they're released, they can at least check some of the things off of their list and get back into community healthy and successfully. Some of the vital project developments that were created in this effort was referral processes that were established, consent forms, referral forms, and a tremendous amount of marketing material, because we wanted to get the word out that Genesee Health Plan did not leave anyone behind in getting coverage in Genesee County. In transitioning to our community outreach here at the health plan, The health plan prides itself on being present in community by participating in resource fairs, volunteering, being present in community meetings, community events, offering sponsorships. Over the past year, the county health plan has participated in more than 80 events. We work closely with community partners such as Earl Jones. As you can see here, we volunteered at Earl Jones to distribute food and water to families as they do so graciously every Thursday. We partner with Motherly Intercession, the Genesee County Free Medical Clinic, Ebenezer Ministries, Clio Safety Net Store, and the Community Access Center. Our Genesee Health Plan team recently participated in a bowl and raised funds for the annual Bowl for Kids. As you can see, our team here on the left, we did great. We raised a lot of funds and it was a lot of fun.
Jamaica's a ringer. She's a good bowler. I can't say the same for myself, but that was fun, wasn't it?
Yes.
Yeah.
And we also participated over the past weekend in the G Card Walk for Warmth. And Jim and some other volunteers walked in the evening for the shelter of Flint in their walk. In the fall of last year, Genesee Health Plan hosted its annual drive-through vaccine clinic. This is something that is very important to community, and they express that they enjoy being able to drive through, receive vaccines, whether they were COVID vaccines, which was offered this past fall, or flu vaccines, which were offered. And we did some additional things like clothing giveaways. Earl Jones was very instrumental in being able to offer clothing, new coats, and different things for families and children. The health plan offered during this drive-through event some basic Narcan training. And I was tremendously surprised, but we had a huge outpouring and individuals who were interested in learning the basic training and to receive some information about that. But the county health plan has been very present in community. We embrace partnerships in community, and we are always here to help. We were able to serve during this particular event over 180 families, which is an awesome thing to be able to do. And we look forward to the next time, to the next drive-through event. But Genesee Health Plan is a resource for county residents. Anyone living in Genesee County can access any of the services that we've discussed on today. And Genesee Health Plan is not just our plan for better health, but it's your plan for better health. And we are here to help.
Thank you, Jamaica. But the drive-through we do every year, and I know we were able to be on the webinars in the past and to be able to talk and encourage people to do that. But what was exciting this year was we talked before about the deaf and hard of hearing community, and the Communication Access Center, or CAC, was able to provide a couple interpreters that went car to car of the deaf folks, because I would think I'm terrified of getting a shot. Just think how if you can't communicate with the person that is giving that shot. And so they went car to car. They were hustling and going all over the place. But talk a little bit about that.
Yes, in our partnership with CAC and Teresa Miracle, we were able to have 2 ASL interpreters present during our drive-through event that were able to help assist with filling out paperwork, to interpret back and forth to the nurses what the clients needed on that day, if they were getting COVID shots, boosters, or if they were here for flu shots or trainings, or if they had any other needs. And I think we have done a tremendous job in making sure that we have not left anyone out in getting services, whether it's the deaf and hard of hearing population, whether it's someone with a language barrier, whether it's someone with an additional barrier, such as a returning citizen. So with that, we have been able to address those issues here at the health plan.
Great, thank you, Jamaica. I know we're just kind of winding down and we've been so happy to do this, but I want to talk about an essay contest that's currently taking place. We have a great partnership with Savita Credit Union, and they help us provide gift cards to winners. And I'm going to show a quick video and then talk about how people and students in particular in Genesee County can participate.
Attention, all Flint and Genesee County students. Would you like the chance to win gift card prizes from $100 up to $400 just for writing about your family health history in honor of Black History Month and in partnership with Savita Credit Union? Genesee Health Plan's 8th annual Health Heritage Essay Contest is going on now through Monday, April 24th. Have a conversation with your family and write about it for your chance to win. For complete rules and details, scan the QR code below or visit GeneseeHealthPlan.org.
You know, Heatherlyn, we've talked over all these webinars, and you and I have talked about health equity a lot. And so this was a brainchild of ours a few years ago, because we were trying to figure out how do we celebrate Black History Month, and what better way is to encourage students and children to talk to their parents. This is a lot of times not a very comfortable conversation. I know, you know, it's not something that we just kind of sit around and talk about. But what we have discovered with these essays is that communication, maybe for the first time, and students and children and adolescents are able to hear about their family health history and maybe what they can do to prevent some things. Let's say, for instance, that diabetes runs in their family and they find that out. The child might not have it yet, but could if they don't look at their diet, maybe some exercise. And so the essay contest is a great way to do it. So, and to talk to their family and then write about it, and you could win a prize if that contest is judged and chosen. So there are 3 areas of students. One is elementary age children. One is middle and junior high children, and then high school students. And so, and it's for all of Genesee County students. And please just go to our website or that fancy QR code that's up on the screen, and you can go there and get all the information. But you still have a couple months, especially a good project maybe during spring break. Really encourage your children to do this, and really encourage you to have that conversation. We owe it to our children and to really start having these conversations so that we can have them healthier.
I love that. And we could even have the kids come and maybe do something on the webinar too.
Oh, wow. That would be fantastic. I like that idea. I'll hold you to that. So, you know, as we're winding down, I just want to say that, you know, you can see our mission here. It's really to improve access to healthcare services to really any Genesee County resident. You heard about the flexible array of services that we provide, and what we value also is the partnerships that are in the community. So if we can't do a service, we can link you to the many partners that have been on the webinar before that are out there that can assist. So, you know, that's really the mission, that's the foundation. And you heard that quite a bit in our presentations that we offered today. So Heatherlyn, I'm just going to turn it over to you to wrap up. And one of the things that I like about this webinar, we had our community health workers on, and I think you'll show that slide, is that they're able to get credits, training credits, and Heatherlyn and MSU have been able to get that for us, and right on cue, right?
Such a good segue. This has been an amazing hour. Genesee Health Plan, thank you so much for just talking about the work you do. And what I loved is that you also gave us a chance to meet and get the names of folks who we can connect with. And we've seen that in the Q&A. We've had folks reach out, hey, can you connect me with Perlita? Can you do this? So we'll make sure that everyone gets connected. And we'd love to highlight your organization. So if you have something that you want to come on and join the webinar, tell us about, please reach out. You can reach me at upholdhe@msu.edu, or you can reach out to Blair. Her email address is on the slide there. If you have questions about CHW CEUs or anything else, reach out. We want to hear from you. And we'll see you next week. Thanks.